Hello there, and welcome to Medicare School Daily. This is a program that is sponsored by our company, MedicareSchool.com, a company that my son and I founded 17 years ago. And we are Medicare brokers, and every day we strive to help people all over the country to understand their Medicare options, to enroll in plans, to enroll in Medicare at the right time, and that's really the focus and mission of our company. We begin our relationships with people with education. That's the purpose of this program and many things that we do. And so I'm excited to be with you today. Normally, Josh, my oldest son, is with me, but he is ill, and so you're stuck with me today. But we are glad to have you. A couple things. I am going to be taking questions here in just a few minutes, so I want to give you the call-in line. We'd love to hear from you. Any question that you have about Medicare, about Social Security, something you're curious about, or even something that you may have a challenge with right now, or we want to address maybe your particular situation that you have questions about, we'd be delighted to have you call in. Our call-in number today is 833-824-2004. That's 833-824-2004. And so if you have any questions, please call in. Our producer, Daniel, will make sure I get your call. Also, some of you may be in a position where you need immediate help. And so if that is you, I'm going to give you our number right into our office as I'm sitting here in our studio right now. And we have the second floor of our office building, and there's 100 people here today that are serving folks all over the country, helping them enroll in Medicare. Of course, look at different Medicare options. So if you need immediate help, you can call this number. It's 833-833-3661. Again, 833-3661. Tell the receptionist that you want to speak to somebody, and they'll transfer you to an agent that, just so you know, I personally know and that I personally trained. I am involved in this business every day, working with the agent and making sure that what I commit to our audience through YouTube or in this kind of a format that actually is going to happen. We are committed to really helping people, and then not just helping them enroll into a plan, but beyond that, there will be problems. Things happen in insurance. And so we have a customer service team that is dedicated to make sure that you're taken care of really for the life of your policy. And so we kind of privileged to serve as your Medicare broker. All right, let's get into the topic today. We're going to talk about some strategies that you can use for reducing your Medicare supplemental premiums. Now, I know some of you that are watching this today are not on supplemental plans. You're on Medicare Advantage plans. And so this doesn't apply to you, but I'll still take your questions. But let's talk about supplemental plans. So when someone has a supplemental plan, they've enrolled into original Medicare A and B, and they have some type of supplemental plan that's going to fill in the financial gaps that Medicare did not cover. Now, Medicare covers well, but other than preventive services, Medicare doesn't cover anything 100%. It doesn't. There's always a gap. Preventive services are covered 100%, but everything else that you have done for healthcare services, there will be some financial liability, some financial responsibility that you're going to have. We call that the balance of the bill. There's always going to be a balance of the bill. And so what we do is we get plans to fill in those gaps that Medicare doesn't cover. And so I'm going to focus today just really on the top three plans. Those would be Plan F, Plan G, and Plan N. Now, I want to clarify something about Plan F. I know some of you watching this could be on a Plan F, but F is not available for all people today. F is the plan that was the number one plan for many, many years. In fact, when I first got in this business, it was the number one plan that lasted for several years. But back in January of 2020, Medicare changed the rules. And the rules are this: if anyone started or was eligible for Medicare prior to 1/1/2020, which meant they were born prior to 1/1 of 1955, then they can get an F plan and keep the F plan their whole life. That group is all grandfathered in. But if I'm born January 2nd, 1955 thereafter, then you can't get F plans. So meaning you started Medicare after 1/1 of 2020, you can't get an F plan. So the F plan is a full coverage plan, which means it covers all the gaps, 6 of the 6 gaps. So people that have F plans today, they should never get a bill. If you're on an F plan and you get a bill, we always say don't pay it. Something's gone wrong. Because as long as you see a Medicare provider and you're getting a service covered by Medicare, you should never see a bill on the F plan. It truly is full coverage. Now, the plan that is second to that now, for those that are starting Medicare after 1/1/2020, would be the G plan. That's what I selected in January when I went on Medicare. And it covers 5 of the 6 gaps. F covered all gaps, 6 of 6. G covers 5 of 6. So on the G plan that I'm on, I'm responsible for 1 gap and will be every year responsible for this gap, and that's called the B deductible. So whatever the Part B deductible is, which is established by Medicare, I have to pay that out of pocket. This year it's $283. Last year it was $257. So the point is it goes up a little bit every year, but whatever that B deductible is, my G plan will not cover that. I'm responsible for that. So the first $283 coming through the B of Medicare, that outpatient side, doctor side, durable medical equipment, outpatient, all those things, I'll pay the first $283. I've already had to do that because of an eye issue. And then after that, 100%. So for those starting Medicare after 1/1/2020, that is the most comprehensive plan available today would be the G plan. And then one step down from that, still a wonderful plan, a good option is called the N plan. Now the N plan, different letters, so a different amount of coverage. So what it does is, remember, F covers 6 of 6 gaps, G covers 5 of 6 gaps, and the N plan covers 4 of 6 gaps. Plus it has a couple copays. And so what the N will not cover is it will not cover the B deductible, just like the G doesn't, but it also will not cover excess charges when those occur. Pretty uncommon that they would occur, but if you ever did have an excess charge, which is when a doctor adds 15% to the bill, the N plan will not cover that for you. Now, excess charges are very rare. Certainly less than 5% of the time would you even see an excess charge, but it could happen. I never want to say there's no risk there because that would not be true. I would just say it's a little risk. And so people that are looking for something a little more budget friendly, maybe a little cheaper than the G plan, can go with an N plan. Excellent option. In the majority of states, it's going to be about $50 difference between the G and the N. Some states, $60, $70 or even more between the G and the N. Now, in my state, Missouri, it was only $35 difference. So I went with the G plan, $35. I was not going to break my budget. And so, but in some states, it just makes sense to look at an N plan. One other thing about the N plan, and that is what it does, it carries 2 copays. And so the copay would be for any time you actually see a doctor. That could be telehealth. It could be you went into a doctor's office. Anytime so you see a doc face to face. It could be a doc, nurse practitioner, a physician assistant, a specialist, primary care doc. Then you would be subject to a $20 copay. So it covers all the co-insurance after you have met a $20 copay. That's the most you'd ever pay to see a doc. And if you went to the emergency room, you would have a $50 copay. Unless you're admitted to the hospital, then they would waive the copay. So the N plan, a little cheaper. You're responsible for excess, which is rare, but you do have a few copays. I had a lady recently that told me that she had serious health problems, but she goes to the doctor on average about 5 times a month. Would not make sense at all for her to be on the N plan because that's 5 visits a month. That'd be $100 extra. So rarely is there that big of a difference between the G and the N plan. All right, so want to clarify those are top plans, F, G, and N. And so as we talk about saving money, what we can do, we have a couple options. One option we can have is actually keep the same plan, but switch to a different carrier, a carrier that may have a lower rate in your particular market. Now, when I talk about saving money, folks, here my view is this. If you can save at least $20 a month or more, then to me it makes sense to make a switch. $10, $15 probably wouldn't. I'd probably wait and just continue to check it every year. But $20 or more, I would definitely consider switching a plan. And so we can, if we're on an F, we can move to a different F. Or on a G, go to a different company's G, or an N to an N. So that's a possibility to simply to keep the same plan, but then change a carrier to be able to save money. Now, another option we have in saving money, we could actually not only change carriers, but we could change plans. So we could be on an F plan and we move to a G. That kind of move would probably save you. And again, I'm just kind of broad stroking this because we're brokers in every state in the country, so it's going to vary. But I would say F to G, probably $50 to maybe $75 a month difference. So F to G, you could also do F to N. If you move from an F plan to an N plan, Still excellent coverage. You're just taking on a little bit more liability, but you could probably save maybe $100 or more a month on that kind of a move. If you're on a G plan, again, you can move down to an N. Still great coverage, a little bit more risk, but minimal. And those moves typically at G to N, you're going to save anywhere from maybe $50 to $75 on a monthly basis. And so, that's a sizable amount of money. And so when we make these kind of switches, I do also want to mention not just are we saving money, but it's like we're kind of resetting the clock, because when you change your supplemental plan and you're going to be in a new group. And so the group that you're in, let's say you started Medicare at 65 and now you're 68. Well, that group that you're in is beginning to shrink. People pass away. People get off plans. They switch plans. And so it continues to shrink. So the smaller the group becomes, the likelihood it will be less stable. It could still be fairly stable, but not quite as stable as a large group. The larger group, it just means the risk is spread out to more policyholders, and the net result to you is stable rates. So we can save money on a monthly basis, but also we're resetting the clock. We're going back into a new group, a group that is more than likely larger than the one you're in. Because yours have been shrinking, and it's going to be younger as well, because most people are going to Medicare around 65, 66, and if you're 68 or above, you're going to go back into a group where the people are younger, which means they could also be healthier. And so that's what I mean by resetting the clock. We can save money on a monthly basis and then go into really a better group. Now, I want to talk about the process. First off, if you do decide you want to do this, there is an application that has to be made. But just know this. If you do make application and you don't get approved to make the switch, there is no harm done whatsoever, because when we make application, we're not notifying your present company that you're considering switching your plan. They have no clue, no idea whatsoever about this. And so, there's no risk involved with that. But you're all going to have to make application. Will not affect your present coverage. No one's canceling anything. So with the application process in most states, not in every state, there's a few states that there would be exceptions, but in most states, to make this switch to F to G to N, or just plan to plan, like to like, you're going to have to go through underwriting, medical underwriting. And so what we have to do is we have to ask you a series of questions, usually about 35, 40 health questions. They're just yes, no questions. There's no medical exams involved. No one's going to draw your blood, anything like that. It's just simply an application with questions. And so we have to ask the questions. We will also record your medications, who your primary care doctor is, and then that information is given to the insurance company, and we go through the underwriting process. That means they're going to look at your health conditions. They're going to look at your medications to see what you're being treated for. And so you do have to be medically qualified to do it. So if someone's in the midst, they just had a heart attack a month ago, you're not going to get approved. You had a heart attack 5 years ago and everything is fine since then, no problem whatsoever. If you had cancer 3 years ago, probably not going to be an issue. In the midst of cancer right now, that's a problem. If you just got diagnosed with AFib, it's going to be a problem. Insulin-dependent diabetic, that you have retinopathy or neuropathy, definitely going to be a problem. So there are some health issues that we just can't get through underwriting. But if it's something that's in your past, 2, 3, 4, 5 years ago, it may really not matter. Now, what we see our job is to make sure we do everything we can to get you approved. And so carriers vary. Some carriers care about certain things that others don't. We have carriers that will ask about your height and weight. So if body mass is an issue, we're not going to go with that carrier. We'll go with one that doesn't ask that. We'll have carriers that will ask PSA levels. They're concerned about that. Other carriers don't even ask about PSAs, for a man. We have one carrier right now. In fact, I pulled this now because this is the only one that does this. They talk about this. They say, have you ever been treated for depression with medication for 2 or more years? So the one carrier that does that. And so no one else does. So if someone is being, taking medication for depression 2 or longer years, we're not going to go with that company. And so my point is, as brokers, we'll try to find a company that we can get you approved. We do not certainly make the final decision. We know what the companies are looking for. We're on your side for sure, but they are going to make that decision. And so if we do get approved, then we set everything up for the plan that you're on now, then to be canceled. You actually have to do that, but we'll coach you through that. We'll talk about the timing. underwriting, we're never going to be paying premiums 2 months in a row. So if we got underwriting approval this month for March, we would tell you to cancel the policy effective 4/1 of 2026, and then the new policy would go effective to replace that. So there's no overlap of payment whatsoever. But if we got denied, again, no harm done. You tried, and more than likely what we would do, we may even try another carrier. Sometimes we'll do that. But the point is, we'll do everything we can to see if we can't switch plans so that you can save money, and then also reset the clock and be in a better group that hopefully will long-term give you more stable rates. All right, and so that's how you can save money. And if you want to reach out to us and allow us to show you what rates are in your area, we're happy to do that. There's truly no obligation, but let's see if we can save you some money. Lastly, I'm going to say this. You can do this at any time. MedSup plans can be switched at any time. They are not tied to any of the Medicare open enrollment periods at all. We have the big one, October 15th to December 7th, so sometimes people think that's when you can switch. Yeah, you can, but you don't have to, because you can switch MedSup plans anytime you want. And remember, when we get approval, that's a lifetime policy. That policy, the only thing they can ever change on a MedSup plan is they can raise the rates. But that's it. They can't do anything else. They can't change your coverage. They can't cancel you because you have a lot of claims. They can't cancel you because you move from one state to another. Those policies are truly lifetime policies. One of the reasons I like MedSup plans. I also like them because you pull out your red, white, and blue card and your MedSup card, and everybody in the country knows exactly how that system is going to work. They do, and they'll accept Medicare. 99% of all doctors will take your supplemental plan. 100% of hospitals will. All right, so we certainly favor supplemental plans. We still write Advantage plans for those people that just don't either want to afford a supplemental plan or can't afford it. Then the Medicare Advantage is also a good option. And so I just want to say this, and then I'm going to take your questions. But right now we're completing what's called the Medicare Advantage open enrollment period. So we will complete it March 31. So there could be someone today that's watching and you're on a Medicare Advantage plan and you would like to move to a supplemental plan. You can still do that until the last day of this month. And so what happens is if you want to return to original Medicare, the way we would handle that is the first thing we would do is apply for a MedSup first to make sure you can get approved. We got to go through underwriting. And if you do get approved, then we would then help you select a drug plan. And then when the drug plan enrollment goes through, that will automatically kick out your Advantage plan. So that's called the Medicare Advantage OEP. That's the code that allows us to get you off Medicare Advantage and go to a supplemental plan. And again, we don't cancel the Advantage until we first have the approval on that Medicare Supplemental plan. And we'd be delighted to help with that as well if that's something that you would like to do. All right, so that's our teaching time now. I want to take some calls and answer your questions. Again, let me give you the number to call in. We'd love to hear from you today. And to help you, the show number is 833-824-2004, 833-824-2004. Please give us a call, and we'll answer your questions today. All right, welcome to Medicare School Daily program here. Who am I speaking with, and where are you calling us from?
My name is Matthew, and I'm calling from Northampton, Massachusetts.
All right, Matthew, great to have you today. What questions do you have for me, sir?
Well, here's the thing. I know nothing about Medicare. I've never been sick. I've never used it, but I just had a concussion, so I'm going to start using some kind of medical care. I'm 83 years old, and I've been fortunate never to be sick, but I happen to have an accident. And so I'm going to be faced with seeing doctors, et cetera, et cetera. I guess I have Medicare A and B. That's all I know. So okay. I'm totally out of the loop as far as doctors and such. I mean, I see a doctor maybe once a year by accident.
Okay. So you fell, had a concussion. What is going on? Is there some type of a swelling or something? Tell me what's going on medically.
I had a lot of. I actually fell, literally flat on my face. Almost. I turned my face when I snapped a tooth. I later find out I also broke the root in another tooth, but in other words, I got some dental work's got to be done. I'm lucky I only injured one tooth, but I injured a root, and another tooth something happened there. But as a result of that, my left leg has lots of pains. Whenever I don't have, I can use it, but it hurts all the time, and different spots here and there, and all of a sudden I'll lose control. I mean, I lose strength in it.
Okay.
So it's continuous, ongoing. Now this happened about almost a year ago.
Okay.
It started a little bit and got worse as it went on.
Okay.
At the same time, my eye began to lose some sight. I mean, I don't understand. I've been to a couple of doctors already. They don't know. They have no idea what's going on.
Okay, so there's been no diagnosis at this time of any kind of disease or illness. Nothing. It's just complications from the fall.
Yeah,
okay.
Just the symptoms. But
yeah.
the dental office said it definitely came from the fall. I mean,
yeah. Sure.
Problems.
Okay, I understand. Well, let me tell you what you may want to consider. I think it's very possible that you could get through underwriting on a Medicare supplemental plan if you wanted to do that. And so what I'm going to do, Daniel, hang on just a second. Dan, do we send a link to him? Is that correct? Okay, very good. We can actually send a link to you that would allow you to set up an appointment to speak to someone, or you can just call our office, and I'll give you the number if you don't mind. It's 833-3661. So if you decide to call in, here's what I'm suggesting. Okay, yeah, I'll go slow. Yeah, yes, sir. 833. 833 again. And then
2833.
Yes, sir.
Okay.
And then 3661.
3661.
Yes, sir.
Now,
And
I automatically get. How do I? I don't know how I pay for A and B. How do I pay for that?
Well, your A is no cost. Your B premium is actually coming out of your Social Security check, sir. That's how you're paying for that. Okay, so you have a couple options here. If you would like to keep your risk to a minimum, then you can buy a supplemental plan. And our agents, when you call in, they can give you prices. Now, you could get an F plan. I wouldn't if I were you, just because they're the most costly. So if it were me, I'd get a G plan or an N plan. If you're looking for something a little cheaper, as you probably heard me say in my introduction, the G plan is going to be maybe $50, $60 more a month. So I would look at both. They're really, really good. They are. But the reason I'm encouraging you to see if something like this would work for you, because you have a tremendous amount of liability having A and B only. You are responsible for everything that Medicare doesn't cover and pay. So and it's unlimited. So you really have a lot of risk, Matthew. So what I would do is find out, do those rates fit your budget? And then if you say, no, I can't make that happen, then what you have the option to do is go ahead.
Well, rates could fit my budget. The question is, I know MRIs are things that are expensive.
Yes, sir.
Correct?
Yes, sir.
And MRI is really expensive.
It is.
But MRI is more precise.
Yeah.
As far as like measuring, especially things to do with the brain. Obviously, something happened with I got whacked pretty. I mean, it's like taking me by my legs and banging my head on the floor. I hit hard.
Okay.
I didn't break any bones, but when I hit, I heard crack, crack. One was my tooth and one was something else. I don't know, but nothing got broken. I've had X-rays of my knee and my hip. Nothing's broken.
Okay.
Nothing's wrong. Well, something's wrong because it's not working. And I always thought I never have been sick. I have never had any pain. Toothache, earache, my only pains in all my life. So I thought I had one big muscle in my leg. That's true. You got a lot of muscles there, because I know, doctor, they all hurt at different times. Just by movement. Not every day. It comes and goes.
I understand. So here's my suggestion. If you were able to get, and it fits the budget, you get a supplemental plan, then if you did that G plan or N, you just have to meet that deductible on an MRI, and then after that, you're going to have pretty much 100% coverage, especially on the G plan. So I like that better, because as you age, more things could happen. And your risk here, Matthew, without any supplemental plan is you're going to be responsible for 20% of everything that's going to be done on you on an outpatient basis. If you end up having to have a surgery, not only would you have to pay the surgeon 20%, but also the anesthesiologist 20%, and 20% for all the tests prior to the surgery. So if you can get a supplemental plan, I would really recommend that. Now, I'm going to make something real clear. earlier, listen, if I were you, I would want to get a drug plan as well, but you can't do that right now. A prescription drug plan you can pick up later this year, October 15th to December 7th. They can't be added at just any time. They can only be added during the Medicare open enrollment period. So you can get a supplemental plan now. We got to go through underwriting, and then you can get a drug plan later this year. Okay, so that's what I'd recommend.
Where I see coverage was very important is in the diagnostic aspects, because you need MRIs for a lot of different things, but they're not. You won't get them. They won't. The doctors won't get them if they're not covered. I guess that's what I'm saying.
Yeah, you're exactly right. But with your A and B and your supplemental, you'll get what you want. You will.
Okay, that's what I'm. That's what I'm concerned with.
Yes, sir. Well, when you call in, just ask for an agent, and they will transfer you to one. And I promise you, any agent you speak with, I know them all. I've trained them all. They know exactly what to do for you and explain your options and go over really every detail with you, Matthew. So I hope you'll give us a call.
Okay.
We'd love to be of service to you, sir.
Oh, thank you very much.
Yes, sir. And I hope you get better as well. Thank you very much. See ya.
Great day. Thank you. Bye-bye.
Bye. Well, welcome to Medicare School Daily. Glad that you've called in. Who am I speaking with, and where are you calling us from today?
Hello.
Hi there. This is Marvin with Medicare School Daily. Thanks for calling. Who am I speaking with?
This is Vicki.
Hi, Vicki. Where are you calling from today?
I'm calling from Texas.
All righty. What part of Texas? That's a big state. Where do you live?
In the DFW area.
All right. Very good. My wife is from Coppell. So you probably have heard of that. Yeah, exactly. So, Vicki,
yes.
What kind of question do you have? How can I help you?
Well, I am a client of MedicareSchool.com.
Good. Thank you.
And I am very happy to be that. I actually found you too late because I've been on Medicare for several years now. Mm-hmm. And people who retire are just not schooled in any way about Medicare, because it is so different from regular group healthcare insurance.
It is.
And I didn't know, and I was led to an Advantage plan, mm-hmm. which I should not have been, because I have 3 major illnesses.
Oh, wow.
And I have kidney disease, diabetes, and rheumatoid arthritis. Mm-hmm. And because now I know from learning from lots of your videos that, yes, Advantage plans are great for some people, but that would not have been great for me. Yeah. And all of this was discussed with a broker, but I was still put on an Advantage plan. And that's crazy. So now my question is, as I'm getting older, my diseases are getting a little worse. Mm-hmm. So what options do I have? If I'm understanding correctly, the only way that I could get on, and this may be wrong, could get on a supplemental plan would be if my plan was withdrawn or put away or whatever. Mm-hmm. Would I have that opportunity, or am I not understanding it correctly?
No, you're understanding it correctly. Whenever the company decides to terminate a plan, meaning it's no longer available the next year, then you have the right to return to original Medicare and get a supplemental plan. What's your date of birth, Vicki?
It's May 1956.
1956. Okay, so very good. So you started Medicare 2021, correct?
I actually, well,
disability?
I was 62.
62. Okay. Well, okay, so if you're 62, that means then you started in 2018. That's what that means.
Yes, that's probably right.
Okay,
yes.
Very good. So here's why I was asking. What happens is you wouldn't, let's say your plan is canceled by the company and it's not available in 2027. You'd have the right to return to original Medicare, but the plan that you can get with no underwriting for you would be an F plan. If someone had they were eligible for Medicare after 1/1/2020, it would be a G plan. So we call that guaranteed issue. So you could get an F plan if indeed your company terminated your plan. So that is correct. Now, another option you have, and I want you to know, I'm going to share this with you. I am not saying you should do this. I don't know enough about your medications, your doctors before, I'd have to know all this first. But the plan you're on right now, is it just a traditional Medicare Advantage plan? Is there anything special about it, or is it just your kind of what we call your typical Advantage plan?
I guess it's a PPO.
Okay.
That's the only thing that I wanted to make sure I could see my doctors.
Okay, that sounds good. Well, what you may want to look at, and you're our client, so you can, after we hang up, you're welcome to call in and talk to one of our agents. But they do have some plans that are called chronic SNP plans. It's just an acronym. It's CSNP, chronic special needs plans. And they have plans that are designed for diabetes and also for kidney. And so some of these chronic SNP plans may be priced more favorably than the one you're on now. I don't know that for sure, but you're asking me what are your options, and that could be a viable option for you to get on a chronic SNP plan. Now, what we would do, we'd have the agent that you talk to make sure your docs would be on the plan. Would it make sense to do that? We don't want you to switch unless we can improve your position. Okay, we wouldn't do that to you. Okay, so if you want to call in, and do you have our number? You probably do.
I do.
Okay, very good. You can call in and just tell the agent. You'll go to reception. Reception transfer you to an agent. Let them know that you called in today. And Marvin on the daily program talked about a chronic SNP plan. And then they can look and see what's available, look at the details, and of course you tell them what plan you're on now. They'll be able to look that up, and they'll be able to lay those side by side and make that comparison. So my point is, at this present time, that's about the only thing you can do. And so if that chronic SNP plan made sense, it's a better option for you. We still have a couple of weeks to make the switch. This is the last day of this month would be the last time it'd be possible for you to change at this time of the year. We can do it again later in the year, October 15th to December 7th, but this particular, it's the first quarter of every year that we can move Advantage plans. And so if you want to call in, Vicki, we'd be happy to talk with you about that and see if it makes sense. Okay? Chronic SNP plans.
I will certainly do that. Okay, great.
All right.
Thank you so much.
You are welcome so much, and thanks for allowing us to serve as your broker, and hope we can help you and maybe even improve your present situation as well.
Yes, and I appreciate all of your teaching videos because that's where I've learned everything.
Well, that's good. Well, I'm glad we met you that way, and hope you'll continue to learn through our YouTube channel. You take care and have a great day. Appreciate you calling in.
Thank you.
Okay, bye.
Yes, thank you.
Hello there, and welcome to Medicare School Daily. Glad you've called in. Who am I speaking with? And if you don't mind telling me, where are you calling from today?
My name's Adam, and I'm calling from California.
All right, Adam. Good to have you today on our program. What questions do you have for me, sir?
Well, I'm 68 years old. I have not started taking Social Security yet, but I was enrolled with Kaiser in California, their Silver Advantage plan. Mm-hmm. They took me off the Advantage plan because I'm supposed to get on a Medicare plan. I can't stay on the Advantage plans anymore, is my understanding. So is that right? Do I have to go to Medicaid?
Medicaid or Medicare? Are they?
I'm kind of confused about both of them.
Sure.
What's the difference?
Okay. Yeah. Well, of course, Medicare, we're eligible for that because we pay into the Medicare tax system. So that doesn't really have anything to do with our income or anything like that. What happens with Medicaid, which California has a Medicaid program, that's based upon income and assets. So we qualify for Medicare at 65 as long as we've paid in the tax system. So Medicaid we qualify for just based upon income and assets. And so has someone told you that you do qualify for Medicaid?
Yes, they did tell me I'd qualify for Medicaid.
Okay, very good. Good. Okay, so what happens, Adam, is they have Medicare Advantage plans that are designed especially for you. We call those dual eligible. Dual meaning you not only have Medicare, but you also have Medicaid. And so there's some very attractive dual eligible plans available for you. So that would be your best option for sure. And so if you want, we'd be delighted to help with that. We write lots of business in California, so we're very, very familiar with that state. And so the way that we would go about seeing if there is something for you would be we'd have to know who your doctors are, what hospitals you'd like to go to if you happen to be hospitalized. So we need to know that. We'd have to look at your medication. So there's kind of some research that we would need to find out on you to make sure that we could find the best fit for you in California, because it varies. There's over 4,000 Advantage plans around the country. And so California has a lot of real good ones. So if you want us to help with that, we'd be delighted to do that. I would suspect right now you are on an Advantage plan, but now because you're eligible for Medicaid, then they're saying you have the option to go on a better Advantage plan. What I mean better is that the Medicaid, Medicare eligibility just gives you some richer benefits, usually lower copays, lower max out-of-pockets, probably some additional maybe dental benefits, some additional maybe hearing aids, things like that. That since you have not only Medicaid money but also Medicare money, there's more services that will be available to you. There could be transportation as part of the benefit, but the point is, the agent would go over all that with you to say, okay, here's your options, Adam, in California for dual eligible plans. Is that something you would like to do?
I certainly am interested.
Okay. Yeah. We'd be happy to do it. And keep this in mind too. When you use us or anybody, you never have to we pay. Our services are provided to you for free. We don't have to work for free, but you don't pay us. It's the insurance company that always pays the health insurance agent. So we can help you. There's no cost at all to you. So if you have something to write on, I can give you our number. You can call in. The switchboard's open right now, and you can tell them that you were on the program, and they'll transfer you to an agent, and they can help you because there's a lot of plans available. Do you have something to write with?
Well, I have a pen ready
to go. Okay, here we go. It's simple. 833. Again, 833, same thing, 3661. So 833-3661. And call the receptionist, tell them that you're on the program. Marvin said that there are some dual eligible Medicare Advantage plans available in California. You'd like to learn about those, and they'll transfer you to an agent. Okay, dual eligible, Medicare and Medicaid, and they'll be able to look up your credentials and all that and tell you exactly what you can qualify for. And then, again, we want to know your docs, hospital choices, medications, all that has to come into the decision as well. Okay. Any other questions, Adam? Does that take care of it?
That does take care of it.
All right,
so much,
sir.
Marvin.
You're very welcome. I appreciate you calling in today, and we'd love to be of help to you further. Just give us a call.
Thank you.
Okay, you're very welcome. Thank you, sir. Bye. Hello there. Welcome to Medicare School Daily. I'm glad you called in. Who am I speaking with, and where are you calling from today?
Yeah, my name is Anna.
Anna.
Thank you. Sorry.
Yes, Anna. That's all right. Nice to have you today. Where are you calling us from, Anna?
From Texas.
Where?
Texas.
Texas. Okay, very good. All right. Well, Anna, what questions do you have for me today?
So right now I'm on the Advantage plan, which is I'm already, but I really like it to change it to the G plan, Supplemental G plan, which I heard you talk so many times how good it is, and I really don't like the referral too.
Okay, that sounds good. Now, Anna, how long have you been on your Advantage plan?
Well, it's long enough for I needed to prove it, to have the what is the
underwriting?
How to say? Yeah, underwrite.
Okay, and that's fine.
How do you say?
Now, Anna, let me ask you this: are you right now dealing with any kind of a health issue?
Not major. I don't have anything with diabetes, high blood pressure stuff,
Okay.
I don't have anything majors on the Medicare majors. Of course, I had a not a major. Yes.
Okay, so nothing major with the heart, lung, liver, or kidneys?
No, I'm very lucky, and I'm thankful.
Good. Okay, and you said you don't have diabetes?
No.
Okay.
I'm thankful.
How about any form of cancer in the last 36 months?
Oh, no.
Okay.
I'm thankful I don't have anything.
Yes, me too. Okay, very good. All right, so are you taking any medications?
Not really. Just the things like for generic $10 here on the day, 30 days, 1 day, something like that.
All right.
It's not like anything that I'm consideration pretty healthy.
Okay, sounds like you are. Well, I think you'd be fine. Now, Anna, the only I guess immediacy to yours is that you can do this, but we need to have it done by the end of the month. So this is something that you do need to get on real quickly. And of course, we can help you do that. And so, do you have our number handy there? If not, I'll give it to you. And then you can call in. I'm going to tell you exactly what to tell our agent. Do you have something to write on, or do you already have our number? Okay.
Exactly. Yeah.
Yes.
But it can be anybody.
Well,
you could be someone.
But,
I'm not trying to discrimination anybody.
Yeah.
But experience counts.
Yeah. I promise you.
Knowledge counts.
Sure. Well, I promise you, anyone they transfer you to, I know personally. I have trained personally. And so you're really, truly, you'll be in good hands, whoever you get. All of our agents are committed to make sure you understand everything. They'll give you all the details. They'll go as slow as you want or as fast as you want. Okay? I want to explain something, though. Once the decision has been made for your Medicare G plan, then what we also will do once we have approval on that is you have to be on a drug plan. And so we will help with that process. And here's why it matters. Once you're approved for the G, then we'll help you with your drug plan, and then that drug plan will automatically cancel your Medicare Advantage plan effective 4/1. Okay, that's the process that's involved. But we'll hold your hand through the whole process. I promise you. Okay.
Yes, I'm here. Yeah,
okay.
I'm listening to you.
Okay, good.
So that means, so you give me just general numbers.
Well,
so then they're going to be transfer me to the agent, the licensed
exactly
agent. I understand that,
That's right.
Yeah, so could it be anybody?
Yeah, well, it's going to be one. Well, it's correct. It's one of our agents, so it can't just be anybody. It's going to be somebody that's trained and licensed to do business in Texas. So it is, and it will be somebody with our company. So do you have our number?
Well, can you give it to me?
Yes, I'll give it to you right now.
I do have it, but I believe I have to go look at it.
Yeah.
I've been studying so much, I don't know where.
Yeah, I'll give it to you, and you can give us a call. It is 833 again. So two of those, 833.
2 times.
Two times, yeah. 3661. So 833-3661 gets you right into our office. You can call right now and tell the receptionist you want to speak to an agent about a G plan, and they'll transfer you. Okay. All right. Well, I'm gonna have to cut you off because I got another caller here waiting before we finish our show.
Right.
But I've enjoyed talking to you, and I'm glad we met you through the videos. And give us a call, and let's get you that plan before the end of the month. Okay.
Thank you.
Oh, you're welcome, Anna. Bye-bye. See ya. Hi there, and welcome to our program today. Who am I speaking with, and where are you calling from?
Oh, good morning, Marvin.
Good morning.
This is Louise calling from Kent, Washington State.
All right, Louise. Well, glad to have you. And what questions do you have today that I can help with?
Several. Brock West did a lot of work, so I'm pretty well informed. My situation is the following. I'm a legal permanent resident, and this year is my 5th anniversary, and that means starting June this year, I'm eligible for Medicare. And
Good.
I'm sitting here with 2 forms I have to fill out. So my questions are very specific to these forms, since not everything applies to my situation.
Okay.
I hope you can help me there.
Okay, I'll try my best. What forms are you looking at?
The first one is the 10797 form.
Mm-hmm.
special enrollment.
Okay.
And all that doesn't apply is easy. I'm not incarcerated and all that stuff. What is left is special enrollment for other exceptional conditions.
Okay.
So I can fill that out, and then there is an attestation I have to fill out,
Yes.
and that's where my question starts.
Okay, go right ahead then.
Sorry?
Yeah, so go right ahead. Let's hear the attestation.
I have to tell them the date of the incident. If unknown, please provide an approximation. What incident?
Okay. Yeah, that's an interesting.
No idea what they mean.
Okay. And so right now you're looking. Tell me what form you're looking at again. You said 10797.
Yes.
Okay. Let me take a quick look at
And
that.
it is page 5. That's where the attachment starts.
Okay. Let me look at it real quickly.
Yeah.
Yeah. No problem. Okay.
Yeah, I'm the 1% you always talk about. I'm the bloody exception. I know.
Yeah. Well, I'm reading it right now. When you use this application, you're eligible for Social Security benefits, but only want to get Medicare. You must be at least 64. So this is an A only application. Like for instance, if I were to go online, I can apply for A only, or I can apply for A and B.
I know.
So this is the one that gives you.
I even did that exercise to see what questions I would get.
Mm-hmm.
Of course, I didn't submit it, but I wanted to see what it looks like.
Right. Yeah. I think your one form that you and I just went through in detail is sufficient. I think this A only.
Okay,
you
fine.
want A and B. I wouldn't do it if it were me. Not necessary.
Okay.
Okay.
Well, then the good news for you. I've been following you. You didn't notice, but I've been following you for the last couple of weeks. And so I made up my mind based on the information you've given me online and in your webcast. I need A and B. Once that is done, I want a supplement G and a drug plan.
Good.
In
good.
addition.
All right. Well, we would love to help you with that. And so when you're ready for all that, then I know Brock is very capable. So you take care of this form for sure. And then when you're ready to go, remember, you can do it 3 months in advance. So really, anytime now, you're eligible. Your supplemental plan will go in effect 6/1. Now, here's the way the drug plan is going to work. Once we have the Medicare number, then that drug plan then can go through. We don't have to have a Medicare number. We don't have to have a Medicare number for a supplemental plan. Those companies will actually take those in advance. But drug plans, we have to have the Medicare number, which you'll probably have within about a month. I'm assuming you're going to get these documents, this document submitted real soon. Is that correct?
Yes.
Okay, good. You get on it, and yeah, I'd say no more than a.
Well, there was also a question like what you hear if maybe that's old information from the Social Security that say you can apply 1 month before you become eligible, and for me that would be the 1st of May and not the 1st of April.
Yeah.
So if I'm not getting punished for being 2 months early, I'll do it.
Yeah.
I mean,
here's the thing. I've never heard that someone would not be able to do it at this time. Okay, I've never heard of that at all. Normally, we can apply 3 months before we're eligible. And so if you've read something that seemed to be accurate, then obviously follow the rules on that. But I think you're fine. For sure, because you want to start June. So, maybe if you just want to wait till after April 1, that'd be fine. That's 2 months. I can't imagine why they would not allow that 2 months in advance. That's just the perfect time. Okay.
Good to know. Yeah, then I'll finish it and maybe send it to Brock. Like maybe you look over it if I missed anything, and if everything's fine, I'll print it out, sign it in an original, and go to the office with the instructions you gave me on what to put on the envelope. and say, well, here's your homework. Let me know if it's okay.
Sure, that sounds good. Yeah, just tell Brock when you talk to him that you want me to look at that. I mean, I'm in the office every day but Friday, so I'm around all the time. So he can catch me. He knows how to do that. Already, I'd be happy to glance at it if you and him want me to. Okay?
Okay, wonderful. But,
all right.
It's the payoff for all the work you did. I know that I have to pay for A and for B. That supplement G is expensive, but right now I have private insurance that's probably about the same amount, but I don't have the perks that Medicare gives me.
Sure.
So I'm thinking in long run I'll be better off.
Yeah, well, that's really good. And really, we kind of privileged to be able to help you, and I'm glad you have learned through our videos, and just anything we can do for you, just stay in touch. Please let us know. We're here for you.
What's my daily homework, Marvin?
Yeah, that sounds good. We'll keep learning. And you know what's neat about learning all this? You can help other people as well, because there's a lot of people have questions, confusion, so you can be a good resource for others. All right, Louise, well, I have enjoyed very much talking to you, and so our privilege to help you. Please stay in touch, and we'll help you every step of the way, okay?
Marvin, my advice, keep your smile. That really won me over.
Oh, wow. Okay, good. I'll keep it up then. Thanks for the encouragement, too.
Okay.
Have a good day.
Thank
we'll see
you.
Okay, bye-bye. All right, so that's it for today. I want to thank everyone who called in, those of you that are watching as well. And then if you want to be a part of the show tomorrow, let me give you the number. You can call in at 833-824-2004. And again, if you need immediate help, just call the office. We'd be delighted to help in any way that we could. Thanks so much.